Flu season is in full swing, but interestingly, the case numbers are pretty low last year. Our Jarrell Baker tells us more.
The COVID-19 pandemic is still plaguing our nation, but one thing we're not really seeing, the flu.
We are seeing very few influenza patients this year. We've had a few sporadic cases that have tested positive, but we have not seen the normal influx like we have in previous years.
This flu season, hospitals are reporting only 620 positive cases between January 17th to the end of the month, according to the Texas Department of State Health Services. Last year, during the same time, there were more than 30,000 flu cases, although more labs reported results. Kelly Crane says the dip in cases has a lot to do with all the precautions we've taken for COVID-19.
Wearing a mask, social distancing, staying home when you're sick, all of these things protect you from a number of respiratory infectious diseases, and flu is one of those.
Health professionals say flu numbers change every year, but typically there's a rise in February, which is why it's important to keep following social distancing guidelines. And yes, you can even catch COVID and flu at the same time.
They are two separate viruses, but you could be unlucky enough to fall victim to both. The symptoms are very similar. And so one who is experiencing flu-like symptoms may also be thinking they have COVID. So it's best really to consult your primary care doctor.
Traditional doctor's offices, usually they will test for everything, just to make sure to rule everything out. If you have symptoms that, everything has flu-like symptoms.
Local health experts say symptoms for the flu show up much faster than the symptoms for COVID-19. They say whenever you get flu-like symptoms, be sure to take a flu and COVID test. In Bell County, Jarrell Baker, 25 News.
Jarrell, thank you. Health officials say an influenza strain particularly harmful to children is the dominant strain for the first time in 27 years. The CDC reports a nationwide total of 32 child deaths related to the flu so far, with 21 of those deaths stemming from the influenza B virus. This flu season, the CDC is reporting at least 9.7 million flu cases nationwide, with 87,000 of those leading to hospitalizations and 4,800 resulting in death.